Wellness Wednesday, sponsored by Baptist Health.
Welcome back. The start of school is right around the corner, which means lots of sports are taking place, whether high school or college. But did you know that most sports-related deaths are cardiovascular in nature? Well, joining us this morning is Baptist Health cardiologist Dr. Scott Davis to explain how a sports cardiology clinic might be of help to some athletes and patients who are very active. Dr. Davis, thank you so much for your time. Good morning. So who needs an exercise and sports cardiology clinic?
Right. So we at Baptist Health and Arkansas Cardiology, we have the first of its kind in our state, a sports cardiology clinic, which combines the expertise of cardiology with the expertise of sports medicine. And it's built and designed to then identify either patients who are at risk or need to identify and work up further symptoms. And so this may be, the patient that develops some chest pain when they're exercising and shortness of breath. It may be the athlete who's in two-a-days in high school sports who may experience an isolated fainting episode. So folks that have symptoms that need further workup that are in and around some type of sports-related activity. And so these patients then may need more thorough testing than what we might get in a clinic, such as just an EKG and a physical exam. These patients then that need return to play testing. So the athlete that does have the episode of passing out needs a workup, but then also needs clearance to get back on the field, to get back in activity at their school. And so our testing involves some basic testing, which is like echocardiogram, more than just an EKG, right? The ultrasound of the heart, but then more sophisticated testing, such as CT-based or MR-based testing, or then the newer cardiopulmonary exercise testing, where we're evaluating, your cardiac outputs and your pulmonary functions. And so we're real proud of this. It's in North Little Rock. It's our North Little Rock campus. My colleagues, Dr. Jay Gohagan and Bob Caldwell, are the two cardiologists that are ahead of the clinic over there. And so if you have any concerns, if any of the coaches out there, if any athletes have, an episode on the field, any kind of symptoms, or there are any risk factors, there's been a family history of sudden cardiac death, then these are the folks that we would like to evaluate more thoroughly.
What kinds of results are you seeing? So,
look, the worst case scenario of a patient, an individual dying, in a field of play is very low, but it's stark and it's sobering. And so what we're hopefully being able to do then is identify front end potential risk factors for those. And so then these tests funnel back into the individual and also to the program to allow folks to get back and get more active.
So what does a visit look like, and does insurance pay for something like this?
Yeah, so then what we'll do is first, folks will usually then first see their primary care doctor, but then they can come directly and see us. And depending on your insurance, I never like to speak because there's so many different varieties of insurance. But as a rule then, that a gross majority of these tests are covered. We always have that conversation with folks before we do any kind of testing.
All right, Dr. Davis, thank you so much for your time. This sounds like a one-stop shop.
Yes, it's very thorough, and we're able to give results right there to patients and then give guidance back to, like, say, a primary care doctor or a coach at a particular program.
All right, Dr. Davis, thank you so much
for
your time. So if you need to contact Baptist, just go to their website or give them a call. That information is on the screen.